Good afternoon, everyone. It's just 3 o'clock. Thank you all for joining. We'll give it just another minute or so and give folks a little bit of time to click over, and then we'll get started. Okay, I think we'll go ahead and get started. This will be recorded and slides will be posted online in the next couple of days. And so folks will be able to catch up if they miss things. We just have a lot of content to get through this year. Good afternoon. For those who don't know me, I'm Allison Kretzinger, our Director of Public Affairs here at the Department of Children, Youth, and Families, joined by my colleague, Renee. I'll let her introduce herself.
Hi, good afternoon, all. I'm Renee Newkirk, the Chief Financial Officer here at DCYF.
I'm going to go ahead and go to the next slide. We are here with our what we call mid-session, although I will note we are a little bit past the midpoint of session, but our mid-session webinar where Renee and I get the opportunity to provide an update to partners on proposed budget recommendations, as well as where pieces of legislation are at through the process. I'm going to go ahead and go to the next slide. For folks who have joined us before, this is a timeline of where we are at. We are in that early April, late part of session phase of the green here, quickly within the next 3 to 4 weeks, heading into the final week of session and then onto OFM governor review and then implementation. Go ahead and go to the next slide. We'll talk a little bit about the realities this year. I just want to note this is a challenging webinar to deliver. I think more challenging than years past. I've been had the pleasure of working on our public relations, government affairs work for 5 years here at the agency. And this year is certainly really different than the 5 that we've experienced prior. I think it's important to just acknowledge the human-centeredness of the work we do at this agency, that we do, that our staff do, that our contracted service providers do, that our licensed care providers do, and the impact that the reality we're in is having on everyone. And I think there's a lot of layer of impact that we're all experiencing in our day-to-day lives. Uncertainty around next steps with the federal choices, the state budget realities, policy landscapes, significant challenges in our communities. And layered on what we'll talk most about today is where the state budget looks like it's headed for our agency and our services. This webinar is really different than the tone and tenor of the webinars that Renee and I've had the opportunity to deliver over the last 3 to 4 years together. I just want to acknowledge that. We will move quickly. There is a lot of content. It is not to minimize the impact of the work of which we're going to talk about today. But it is the reality of needing to get through a set of content in a limited time. There's a question and answer function in the webinar format. I invite you to use that. We will answer some questions potentially live, verbally. We might respond to some in typing, and then some we may not know the answer and we'll need to get back to folks. So as we sort of move through this, I just think it's important to ground us in the realities that are right before us. It's year 1 of a biennial session. It's a long session. Those of us on the ground here are certainly feeling the length of this session. We have a new governor. We have significant lawmaker changes, new leadership in some of our policy areas. We have a mixed and complicated revenue reality and economic reality, and I'll turn it over to Renee to talk a little bit about the economics.
Thank you, Allison. Yeah, thank you for really leaning into the human impact of this. As Allison noted, this is a really different and difficult webinar to deliver to you all, as we'll be covering what each the House and Senate proposed budgets include. The economic reality, as you all may probably know, our state is faced with an operating budget deficit of approximately $16 billion. That is up by nearly an additional $1 billion with the most recent revenue forecast that came out, which is what brought the budget deficit that we're facing to $16 billion. So very, very difficult, challenging times for our state to close that gap and put forward a balanced budget, which is very, very difficult. I can only imagine for the legislature to put forward. So as Allison and I review the slides of what's included in each the House and Senate proposed budgets, just for you to know as well, each chamber includes additional revenue assumptions. So we're not going to go over those, but just to know that each the House and the Senate include additional revenue assumptions. In addition to that, then what we'll be reviewing is the expenditure impact, the savings impact to that, which does include some elimination, some reduction of services with very, very little new investment. So with that, I'll turn it back over to Allison.
Thanks, Renee. Go ahead and go to the next slide, and I'll talk a little bit about the format as we dive into the child welfare and prevention or PPS service area. At the outset of each of the 4 sections we'll walk through, there's 3 sections we'll walk through, and then the 4th will just be budget. There's a blue side that covers the policy bills. We'll talk about the policy bills in play for a given area. The purple slides then, this will become obvious on the next slide, will outline columns, sort of items for consideration in budget, and then the column of the House and Senate approach. We'll talk through the new investment or the reduction associated with various items there. I will note the bill landscape in the vast majority of our space is pretty limited this year. I think that's a reflection of a variety of things. The climate we're in, often new ideas and new laws cost money, and there isn't a lot of appetite for new. In addition, the agency has experienced significant policy change, good policy change over the last 4 or 5 years that we continue to implement and refine. And so you see some of those changes still unfolding and evolving. So just really quickly, I'm not going to go into grave detail on all of these bills. Certainly you can find more information on the legislative website, but just highlighting a couple of things here. House Bill 1177 directs some rulemaking for the department related to our child welfare housing program. This is a program we've been administering for a number of years now in partnership with local housing authorities. House Bill 1509 is about community-based family reconciliation services. I'll take a second to just honor the work that has been done by many stakeholders, many partners, community partners, staff, and young people with lived experience who have spent time in a co-design process to really reimagine what service could look like for adolescents at risk of family separation or in conflict with their family. Together, we put forward a piece of agency request legislation and decision package for a community-based model. In light of the budget reality, the bill has been skinnied. I did not move forward as agency request legislation, but Representative Taylor picked it up. It has been skinnied. It includes 1 pilot site, but does codify it and I think signals the direction that many folks who have worked on this issue for years agree is the right path forward. The other 2 bills with larger dollar amounts on here concern the special ed multiplier rate. That's relevant for the DCYF portfolio because it links our early support for infant and toddler program to special ed and funding in the K-12 system and that multiplier rate. So you see funding for that there. With that, we can go to the next slide and I'll turn it over to Renee.
Thank you, Allison. So I'll be reviewing with you our prevention and child welfare inclusions of what was included in the Senate and House proposed budgets. You'll see here on the left-hand side is the Senate budget, on the right is the House. So you will see where the 2 chambers are in alignment and where they have different assumptions. So with the first one, this first slide captures underspend savings. So intensive foster care assessment is taken by the House with $300,000. The House and Senate are in alignment with sexually aggressive youth and guardianship subsidy underspend assumptions. DS, referrals and transitions. I just want to note here this $2 million reduction, which is an underspend, which we agree with. And so there is no challenges or barriers for the department to continue to meet the requirements of the DS settlement agreement. Caregiver supports adjustment. You may recall in this current biennium for the 23-25 biennium, we received funding to implement a new 7-level foster care system, which includes supports for all caregivers. And that was funded based on a phased implementation approach. So with the Senate reduction here of $26.5 million for the biennium, this would assume no further phasing in of caregiver supports. And then the House takes a more targeted, intentional approach of eliminating project management support for caregiver support services, in addition to a 10% reduction of placement supports for caregivers. So we can go ahead and go to the next slide. And then as you can see here, the Senate for child-specific underspend assumption, what child-specific is referring to here are our child-specific licenses that are issued for our caregivers who have children placed in a kinship placement. There's also an assumption for a $5 million reduction for our EPS beds. And then there's also a global $20 million assumption in the child welfare program of underspend. I just want to note here, as you see these in the Senate, we do not see these underspend savings assumptions in the House. Just noting here that the department disagrees with this analysis of this level of underspend in these areas. In looking at the Senate analysis, there's some missing expenditures included in the analysis. Doesn't account for the rate of spend. So when I say that, for example, we spend a lot of our federal grants at the beginning of the year. And then once those are capped and those federal funds run out, then we're spending more of our state dollars towards the end of the state fiscal year. So the analysis is missing a lot of information, and we are working with the Senate on that understanding. So just wanted to note here that while this looks like these are deep underspends, just disagree with those assumptions and working with the Senate on that. The Senate and the House do both put forward some savings assumptions, underspend for combined in-home services, with the Senate reducing this by $3.8 million and the House reducing by $2.9 million. So we can go ahead and go to the next slide. And then program eliminations. Just want to note here that most of these on this slide, these are services that are not offered statewide. So with the Senate taking the approach to eliminate the continuum of care service, which is provided in our Spokane area. Pediatric interim care, the House takes this elimination for the Pediatric Interim Care Center. And intercept program elimination, just want to note here, this taken in the Senate of an elimination. This does not impact any clients or services, as this was a pilot program that was funded and it was delayed. And then once we saw sort of the budget picture and such, just chose not to implement this, given the fact that it would not be ongoing. So just to further just reduce impacts to services to clients. And then in the House, elimination of the Mentor Washington contract. So we can go ahead and go to the next slide. So program reductions, our home visiting program in the Fair Start for Kids Act, there was a prenatal to 3 engagement included in that. And so this reduction here in the Senate eliminates that. So that would equate to approximately a reduction of 450 home visiting slots. So wanted to note the impact there. And then the House budget takes a reduction of 1.7 million and 7 FTEs for family reconciliation services. Family preservation services, which is also part of our combined in-home suite of services. The Senate takes a reduction of $6 million, also assuming underspend. So again, just working with the Senate on the analysis of that assumed underspend. And then the House taking a much different approach in continuing to invest in family preservation services for that rate increase that was received this biennium and making that rate increase ongoing. So we can go ahead and go to the next slide.
Hey, Renee, can I just pop in really?
Yes.
Sorry.
Yes.
There's a question that I hit the wrong button on. I was going to type an answer. Jill, independent living was not left off. We will cover that at the end. It's actually funded in our program support budget. Sorry.
No, thank you, Allison. Okay, so in child welfare and our prevention services, these are new investments. So as we noted, there's very, very few new investments in these proposed budgets, but there are a few, so we'll cover those here. Plan of Safe Care, the House funds an additional 1.2 million for an additional three sites in 3 counties. Critical Incident Review staff, this is included in both the Senate and the House budgets. A foster care work group, this is a specific proviso included in the Senate budget only. Rising Strong, this is continued to be funded in the Senate and the House for the biennium. And Positive Indian Parenting, also an investment included in both the Senate and the House. The DS compliance, the department has submitted a decision package that was also included in Governor Inslee's proposed budget, and the House takes that investment as well, so we can continue to meet the agreements of the settlement agreement. And within this, it includes some additional placements. So it includes additional group receiving care beds, some EPS beds, intensive group receiving care beds, so additional placement services so we can ensure to keep those young people out of those hotel stays and have stable placements. Okay, we can go ahead and go to the next slide. And with that, I will turn it over to Allison to cover the early learning bills.
Great, thanks so much. Talking a little bit about early learning, I'll cover some of the bills and walk through some of the budget items related to that last bill. Again, a quieter year, I think, on the policy side, recognizing that the budget reality and budget recommendations from the proposed chambers will have a dramatic impact on the system, the early learning field, access to care and such for families and supports for providers. A couple of bills that adjust ECAP age and when they can enroll in ECAP. This does not change the entitlement. That's 1351, 1314, because I can go in order, is the facilities bill, which actually happy to report has made its way all the way to the governor's office. Will be a 5-day bill and pending signature. Unless it's already been signed, I could have missed that, but is there. So this makes a variety of changes to the early learning facilities grant program that came from providers and partners and advocates and Commerce and DCYF as we've been implementing this for a number of years now. Couple other policy bill highlight 1648 concerns professional development requirements for childcare providers. That continues to move and has changed over time. Vital records is a small technical bill that allows additional types of records for date of birth or for enrollment into ECAP. The other bills, 1489 and 5769 and 5752, all contemplate funding levels, delaying entitlements. 5769 caps transitional kindergarten, etc. So just will note that. I'm going to talk a little bit in more detail about 5752 on the next couple of slides. This is the Senate's bill that contemplates a lot of pieces of the early learning space. It does make some elements and items subject to appropriation, and it does add some language around moving forward with the Child Care Development Block Grant compliance, or the CCDF compliance. So if we want to go ahead, and go to the next slide. So a variety of eligibility changes that I'll highlight. Eligibility expansion to 75% SMI for Working Connections childcare was slated to come online in July of 2026. That has been delayed to July of 2029. Childcare employee eligibility. So currently, if you're employed at a childcare, you are eligible for Working Connections up to 85% SMI, and your copay is waived. The Senate Bill 5752, as passed the Senate, eliminates that eligibility category. Many of those childcare providers would retain Working Connections eligibility. However, many would have a copay, and there would be about 300 or so that would lose eligibility because they fall above that 65% SMI threshold. So there is an impact to childcare access for childcare providers. Similar, the registered apprenticeship program, as the bill passed the Senate, it eliminates that eligibility for registered apprenticeship. This N is much, much smaller, I think just in the double digits of folks accessing that. The Senate also assumes through 5752 as passed the Senate, a change in family co-payments, an increase to co-payments October 1, 2025, and then an additional increase next October by adding a per child calculation or an additional co-payment when there is more than one child in the house. Additionally, 5752, as well as, can't remember the House bill, both budgets assume the delay of ECAP entitlement. That was slated to come online next school year as well. That is delayed until the 2030-2031 school year. Can go to the next slide. Some programmatic reductions taken in each budget. The trauma-informed care enhancement is in the Senate budget is eliminated for center-based providers and retained for family child care providers. That is because it is a collectively bargained item, and both budgets fully fund the collective bargaining agreement between family child care providers represented by SEIU 925 and the agency or the state. The House makes a reduction to that program, but retains some resource there. Infant and early childhood mental health consultation is reduced pretty dramatically in the Senate budget, taking it back to the pre-Fair Start for Kids Act levels. And the House assumes a bit of underspend. It's specific to the tribal infant mental health consultation program. Dual language designation is eliminated in the Senate budget, eliminated for center-based providers, retained for family childcare, as that is a bargained an item. And the House makes some reductions by about 50% to the funding for that program overall. Early ECAP is made subject to appropriation in 5752, and then the entire funding is eliminated in both budgets for the early ECAP program. There are about 178 slots for early ECAP, so there's an impact to about 170 or so children, families who will lose that early ECAP slot. Many hopefully will retain childcare, but that early ECAP program will, in both budgets, is proposed to be eliminated. Go ahead and go to the next slide. Another delayed implementation is Working Connections childcare subsidy rates. Center-based rates moving to the 85th percentile of the most recent market rate survey, which was completed in 2024, is delayed until July 1, 2026. That's a one-year delay from what current law requires. So the House also adjusts the language related to hold harmless. So for some childcare providers, for some ages and regions, just a handful, they're paid above the 85th percentile based on a funding decision made a couple of years ago. The House eliminates that clause, and all childcare, all center-based care would be at that 85th percentile. And then noting here the collective bargaining agreement between family childcare providers represented by SEIU 925 and the state is fully funded. And with that, I will turn it over to Renee to talk through the rest of the early learning slides.
Thank you, Allison. So just noting here some additional ECAP adjustments. Both the Senate and the House fund a rate increase for school day slots. The Senate takes the approach of a 10% rate increase in fiscal year 26, whereas the House increases the rate by 5% in fiscal year 26 with an additional 5% in fiscal year 27. Both proposed budgets reduce part day slots by different slot numbers. As you can see, the Senate reduces it by 3,245, whereas the House reduces it by 2,350. And then the Senate increases school day slots by 1,200 in fiscal year 26, whereas the House converts 250 part day slots to school day slots in fiscal year 27. And then the House assumes some projected underspend in ECAP complex needs funds as well as Eclipse. So we can go ahead and go to the next slide. Some additional adjustments here. So the Senate eliminates equity grants, and the House takes a $5 million reduction to complex needs, which results in about a 20% reduction in the complex needs grants. And then there's also a reduction in the early learning facilities technical assistance, and this is assumed underspend, so assumed no impact here essentially. So we can go ahead and go to the next slide. Some other programs. So the House takes a $4.3 million reduction in contracted professional development. And then there's also reductions in facilitated play and learn groups. 1.3 million in the Senate and 770,000 in the House. The House also removes all funding for coordinated recruitment and enrollment. And then there is some investment in the Washington Communities for Children, with the Senate providing an investment of $2 million and the House investment of $300,000. So we can go ahead and go to the next slide. And just noting here, there's some capital investments. These are not in DCYF's capital budget. This is in the Department of Commerce capital budget, but just wanted to note here is there's a benefit to the early learning program, these additional investments. So investments in the early learning facilities fund in both the Senate and the House, as well as some additional investment in emergency grants and the minor renovation grants. So just wanted again to note that here. So we can go ahead and go to the next slide. And with that, I'm going to turn it over to Allison to review the juvenile rehabilitation bills and funding.
Thanks, Renee. A couple of pieces moving through the conversation, the policy conversation related to upstream work and JR realities, given the growth of population in JR over the last year. Both 5278 and 5296 continue to move through the process. The 5032 adds the clarifies, I guess, or adds clearly the role of the ombuds in supporting constituents in accessing JR related matters. We see a delay and adjustment of duties related to the institutional ed timelines through 1827. We also see continued movement of the prison riot offense bill, which clarifies that DCYF operated or county juvenile detention facilities are not correctional institutions for the purposes of prison riot, which will change some and vacate some sentences there for young people. We also see 1391 continue to move, which really now looks at sort of data collection and new diversion data reporting, a helpful tool as we continue to try to focus upstream in the state. Harder to do in these moments, I recognize. And then also a couple technical bills related to our role in Medicaid and reentry through the waiver process, and then a small bill that impacts some of our staff, given we have boilers at some of our facilities there. Go ahead and go to the next slide. I'll walk through the investments and provisos in the JR space. In contrast or juxtaposition to many other parts of the webinar that Renee and I have delivered, the legislature does provide investment in the JR space. This is certainly in response to growing challenges and growing population that we have experienced over the last year, and ensuring that we have adequate capacity and resources to meet young people's needs, as well as support staff with the tools they need. Both budgets fund Harbor Heights facility, which is a new JR facility located on the grounds of Stafford Creek. It would be a 46-bed facility for young people, slated to open later this year in June, and then we'll phase in full capacity and operation there. You see additional funding for parts of our decision packages for classification specialists and the behavior management system implementation, as well as continued investment in opioid use intervention, opioid use disorder medical staff. This is really about the recognition that many young people come into our care with significant substance use disorder, and ensuring we have adequate treatment levels, treatment modalities, and tools is very important. Surveillance records was funded in one budget, and then you see continued investment in some of the contracted security at Echo Glen. Couple other buckets in the JR space, if we want to go to the next slide. There are a couple of provisos that direct DCYF to do some reporting around capacity needs, population growth. You can see the similarities and differences in those approaches there. And then a reduction to the Kitsap Credible Messengers program, or an elimination, I guess, in the House budget proposed, as well as the House budget proposes a sweep of the underspend. Renee talked a lot about the context of the underspend. We remain concerned about the data assumed to build some of these underspends. With that, we can go ahead and go to the next slide. I'll touch briefly on the capital investments in JR. So in addition to capacity at Harbor Heights, there is a recognition in the House budget that that is probably not a sufficient long-term option or the only beds necessary. And they direct DCYF to evaluate and start the pre-design and design work to utilize Mission Creek for a potential additional facility. That is not in the Senate budget. Otherwise, you see nearly identical investments in capital upgrades, capital projects across our JR footprint, including our master plan, which will really be that deep dive into population trends, facility planning, both ideally in sort of small community-based facilities. So that will be the on-ramp and the entree to really dig into those details over the next year or two. We can go ahead and go to the next slide. So in our program support bucket, this is the fourth code, if you will, in the DCYF budget, and some of those pieces that straddle multiple parts of the agency, back office, adolescent support end up in this programmatic budget just for technical purposes. And when we do the mid-session, we tend to break it into the 4 buckets because the volume is so great. It's just easier this way. So thanks for the patience, Jill, as we made our way to this slide. CWIS, which is our comprehensive child welfare system, the Replace FamLink, has been a project underway for a couple of years through feasibility study process. We are ready to go live and begin the implementation of that technology system change. The Senate budget fully funds that, and the House budget partially funds that, about 50%. The House budget chooses to eliminate the a proviso in our budget related to some work that Team Child does, focused on young people potentially stuck in detention release. You see both budgets include, well, one with resource, one with language to continue the work around benefit preservation for young people in care. It's really about the preservation of benefits that young people may get through Social Security or others, and then ensure those resources are available to them for their care. The Senate proposes a LifeSet program elimination. So nearly eliminating the funding there for LifeSet. And then you see an independent living investment funded in the Senate budget. This is provided to maintain the rate that was provided in 2024 that at that time was ongoing and had one time and continues to serve a one-time investment. We want to go ahead and go to the next slide really quickly. I'll just highlight 2 provisos that are important in other agency budgets. There are a lot of other things happening in other agency budgets that are not included, and our apologies for that. There's an element of sort of time and perfection and volume that we have to balance here. So I'll note that the insurance commissioner study was included in the Office of the Insurance Commissioner budget. This is really in response to what we are seeing across DCYF care, not unique to any one part of the agency, in the challenge of being able to get liability insurance or underwriter insurance to provide the services they provide. Some investment in gender responsive care and Commerce's budget. This supports one of our partner organizations. As well, I'll just note, not included here, there's a significant reduction in OSPI's budget related to supports for young people accessing education who are experiencing foster care or homelessness or other barriers and factors. And so you see significant reduction in some of the services there that run through OSPI to community-based providers for some of that support. Important to note that, apologies, it's not on here, perhaps we'll get added before we get these posted, but important to note that as that would have a huge impact to our population of young people in our care, especially on the foster care side. Go ahead and go to the next slide, and I will let Renee talk about staffing impacts.
Yeah, thank you, Allison. Just want to note here, won't spend a lot of time on this slide, but both the House and the Senate do fund the collective bargaining agreement. So state employees would receive a 3% increase in fiscal year 26, which is July 1st, 2025, and then another 2% effective in fiscal year 27, which is July 1st of 2026. In addition to that, there's also some classifications, different job classes receiving increases as well that's noted. And then the Senate and the House budget, they take different approaches regarding sort of our administrative efficiencies and reductions, if you will. The Senate proposed budget takes the approach of 8.67 hours of reduction per month for fiscal year 26, which equates to 13 furlough days in fiscal year 26. So 13 furlough days, no furlough days in fiscal year 27. And then they do also reduce about 14 FTEs in our program support budget. And what's included in program support is Some of our prevention services, those adolescent services, that unit, that programmatic unit is included in program support, but largely it is back office. It's HR, fiscal, IT, administrative services, a lot of the back office supports that helps support all of the services delivered and such. And then the House does not include furloughs. The House takes a more directed, intentional reduction approach by reducing about 23 FTEs in child welfare, 7 FTEs in our early learning division, and 14 FTEs in program support. So just sort of in summary, that's the different approaches in the House and Senate. Very, very different. But that's the approach in the proposed budgets. All right, with that, I think that concludes our webinar, so we can open it up for questions.
There are some questions that have come through that I've responded to with typing. Some we've answered live. So keep typing in your questions. Renee and I are happy to hang on. I guess it only took us 35 minutes this time, Renee, to get through that content. Renee, there's a question on the staffing. Have they considered delaying salary increases to the following year instead of furlough days? I'm not privy to options or dynamics there. I don't know if you have more to add.
Agreed. Yeah, I don't have anything further to add. I don't know. I'm sure there's a lot of various options that are being considered right now. Just not privy to what all of those options that are being contemplated are.
Question about there's a question about FTE reduction on the last slide. Are those in addition to FTEs reduced through program elimination or inclusive? Those would be in addition to.
Yes.
In addition to programmatic reductions if program funding is eliminated. I also just want to note, there was a comment in the chat that I responded to about 1391 funding, and I have live Teams chats. The funding in 1391 was for the courts, not for DCYF. So yes, there is funding in 1391, but it is not DCYF funding, it is county court funding. Of all these cuts and reductions, can you talk about those you are most concerned about, given the majority are bad? Lori, normally you throw me a softball question, Lori. That is not a softball question. I can't tell you the impact of one versus the other and what one's worse. Holistically, I think it's okay, Lori. You don't have to apologize. It's a fair and appropriate question. It's my job to take the tough questions. It is a challenging budget to talk about, to unpack, and to begin to weigh in on. I think most pressing, we are concerned about broad assumptions related to underspend, that underspend does not exist, which we don't believe it will or do. Then it will have different and more severe consequences for our work. And I think that's just how I would say that. So I think it'll be important, and we're working hard to clarify with our lawmaker friends and staff that we know times are tight. We know decisions have to get made. And the more clear and direct and accurate those decisions are coming out in the final budget, the more clear and direct and intentional the impact is going to be. So I think that is how I would frame that. Renee, I don't know if you have any more to add there.
Yeah, no, I think that was really well said. That is the most concerning, I would say.
There's some comments about staff salary. I don't disagree. I hope you're engaging with your union partners to engage in those conversations. There's a question about the network administrator. There was no contemplation in either budget about changes to the network administrator statute or funding levels. You're welcome, Lori. Happy to take your questions. It looks like some HHS funding cuts were announced today and frankly this week. Will there be any future conversations around federal outlook at the end of Ledge session webinar? It's a great question. At this point, we have not seen the legislature react to the federal stuff, the federal realities and choices we know to date. It's hard to know what the legislature may do and what the impact of all the federal changes, reductions, staffing realities will be in the state. So more to come. We don't have anything to share today. We're monitoring the federal landscape and the federal realities very closely. Renee and I and some really very smart, brilliant people on her team are tracking this very closely. And we're talking about it frequently. At this point, it's hard to know what will happen or what to do. Thank you. Thank you. Thank you for joining. I also just will reinforce, as I started at the top of the time today, this is really, really challenging. The juxtaposition of cuts and then some investments in areas across the agency budget is really challenging for staff, for our partners. It's just a really, and layered with the uncertainty of what else is to come. I recognize the concern and the anxiety for everyone. Yeah, 1509 is now one community-based pilot. There was a question about clarifying what's in that bill. It is now one community-based pilot. Happy to stay on for a few more minutes and see if there's more questions that trickle in. Renee and I are available. You have our emails, or at least mine's publicly available on the website. So feel free to email me. I think the other thing I'll just note is we're also in a moment where we don't have all the answers and a lot of information. And for someone who is a perfectionist, although I don't think Renee would describe me that way some days, but wants to solve problems and wants to provide accurate information and wants to help, it's really hard to not have all the information. And I think, unfortunately, certainly for the next 4 weeks related to the state budget reality, maybe a little longer, 6 weeks, we're not going to have all the answers. We're going to share what we know. And a lot of times we're going to say, we just don't know yet. And appreciate the grace and the patience with not only Renee and I, but the other 6,000 people here at DCYF who are in the same exact boat we are. We're working hard to share what we do know when we do, as transparently and as quickly as possible. And sometimes it's just not possible. Things are moving really quickly and sometimes we just don't know. So appreciate the grace, the patience, continue to ask questions, and just understand we may not have the answers. Are questions that have not been answered. I am not seeing any more questions on my end unless I accidentally clicked through one. If you want to retype the question that hadn't been answered, I'm happy to connect on that. Some we answered live, so I didn't type a question, so you may just see the question, I think. Yeah, and then it says this question has been answered live. So if we answered it verbally, I didn't also type a response. Oh, apologies. My understanding is that 1509 sponsored by my rep in my district was going to keep FTEs, as it would not be sending this to community, if I understood correctly. So I think the question here is about the intersection of 1509 and the DCYF FRS staff. So the House is passing and 1509 continues to move. They do fund one pilot. The House budget, I'll look at Renee, I think also, if you want to speak to the FRS reduction.
Yeah, the House budget reduces funding and 7 FTEs for the FRS reduction. How that is implemented, the department has yet to determine how that's going to implement. There's just a lot in play. That was an area where the Senate did not take that reduction. So we'll see what happens as the Senate and House are currently in conference and negotiating. So that is yet to be determined and known. So sort of back to it, Allison was communicating, there is a lot of unknowns here. So we're just communicating what we do know. So that is a proposal in the House, but how that reduction would actually be implemented has not yet be determined, but we will definitely communicate when we do know so if that is a reduction that is included in the enacted budget.
Just another question of logistics. When will the recording be made available? That's a great question. My team works really quickly to sort of pull this down and do all the things magic that needs to happen to it and get it posted. We have one web person at DCYF. And so depending on what's ahead of this in the queue, hopefully by the end of the week, although I recognize today's Thursday, it may be Monday before it's available online. I think the other thing I'll just remind folks, we are in, there's about 4 weeks left of session, 3 to 4 weeks. It's supposed to conclude on the 26th of April. We do not anticipate to see the final budget until very near the end of session. So sometime that last week of April. And then it's going to take time. I want to be really clear. It's going to take time for DCYF to unpack that budget. There was a question about infant mental health, early childhood consultation. That's a great example where some things are obvious in a proviso or a rec sum, and some things happen in what's called the back or the base, and just in our sort of carry forward and maintenance levels that aren't totally obvious at the outset. It's going to take us a couple of weeks to comb through and get through all of the detail of the budget. We'll do an end of session webinar the week of the 11th, I think is Monday, of May, and share what we know then in addition to the internal pieces. Yeah, and there's a comment in the chat. Yeah, we could have a special session that can go to the last day of the fiscal year, and that has happened in the past. That is very accurate. That has happened in the past. I am hoping that that is not the case this year, and we will just, time will tell over the next few weeks. It is true that if session does not conclude in April and there is a special session, or folks, the legislature does come back to town after the work is hammered out, we will not be doing an end of session webinar in May, and we will be doing that at a later date. I'm putting dates on the calendar. I'm optimistic, and I will retain my optimism until it is no longer appropriate to be optimistic. Yeah, the impact of that is significant. Well, again, I just really appreciate folks joining and attending, and again, lots to unpack, lots of similarities, lots of differences, and an ever-changing revenue and economic reality and climate and ever-changing landscape. So I would also say, as I said yesterday to our staff who attended, take care of yourselves, be kind to each other. This is hard. It is hard work. People are tired, and we all feel that. I know you all feel that. And just, trying to find the humanity in the work we do together. We're all here because we care deeply about the work we do. So just remember that, and we'll share more as we know it. Thanks, everyone. Jessica, you can go ahead and end the webinar. We're done with questions or the recording.